Good morning, attendees of today's Melbourne Institute Virtual Colloquium. Today's colloquium is focused on mental health in Australia and the effect of COVID-19 and the resulting economic disruption on Australians' well-being. This colloquium was created to provide insights that help us to better understand Australian economic and social policy through the lens of Melbourne Institute researchers. I am Abigail Payne, Ronald Henderson Professor and Director of the Melbourne Institute, Applied Economic and Social Research in the Faculty of Business and Economics. Let me extend a warm welcome to each and every one of you. Let me acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Please also join me in extending a special welcome to our deans and deputy deans, our advisory board members, and key members of the government and policy community. Before I introduce my colleague, Professor Peter Butterworth, let me remind you of a few housekeeping matters for this colloquium. This is being recorded. We have asked Peter to deliver his insights and then address your questions and comments. He will speak for approximately 25 minutes. Following a couple questions, we will ask our reactor, Ms. Vicky Ryle, to comment and provide her insights. To handle questions and comments, I am relying on the Q&A function. This can be found at the bottom of your screen. Please submit questions at any time using this function. Peter Butterworth's primary position is as professor at the Australian National University's Research School of Population Health. He also holds an appointment with the Melbourne Institute, and so I am delighted to call him my colleague. Peter's research focuses on the social and economic determinants of common mental disorders such as anxiety and depression. Peter's background is in psychiatric epidemiology, psychology, and biostatistics. I'm looking forward to Peter's insights on the status of mental health during this pandemic and his thoughts on Australia's response to the crisis from a mental health perspective. Let me also briefly introduce Vicky Ryle. Vicky is Executive Director of Clinical Practice at Headspace. Headspace was created in 2006 as a service provider of tailored and holistic mental health support of teenagers and young adults. Vicky joined Headspace in 2006. She has spent over 25 years focusing on the needs of young people who are difficult to engage, are at high risk, and who present complex needs. Vicky has led service design, development, implementation, as well as major changes to improve clinical decision-making, governance, and implementation of evidence-based practices. Vicky is a passionate advocate for youth mental health and youth participation. Vicky will provide her experience and insights to more fully inform our exploration of the research and analysis that will be presented by Professor Peter Butterworth. Please join me in welcoming Peter Butterworth.
Thank you. I'll just get my presentation set up. And there we are. So before I begin, I need to acknowledge my collaborators on this project. I also need to acknowledge that I'm taking advantage of the hard work of many others at the Institute who've designed and managed the Pulse of the Nation survey. And I should also note my affiliations with both the Melbourne Institute and the ANU, and also work that I have done with the Commonwealth Department of Social Services, but point out that the views presented during this presentation are all my own and should not be attributed to these organisations or any other individuals. I'll provide a brief overview and outline of my presentation this morning. So the presentation will largely be focused on presenting new data. I'll provide a brief scoping of the field, but will move quickly onto a description of the Pulse of the Nation survey. One of the key issues will be to explain the merits of the measure of mental health or distress that's included in the Pulse survey, so I will spend a bit of time doing that. I will then report on estimates of distress in the pre and post-COVID world, examine patterns of distress during the COVID pandemic, and then consider distress in relation to Australian policy responses and financial stress. I'll then briefly wrap up before handing back to Abigail and Vicky. There has been much public discussion about the likely impact of the COVID-19 crisis on mental health in the Australian community. This includes, particularly when considering the longer term impacts of COVID-19, the economic impacts associated with unemployment. The research literature shows how hardship and deprivation, financial stress, debt, and economic insecurity are all potent stressors and significant causes of mental ill health. But it's also important to recognise that work also provides many people with a sense of purpose and identity. It provides a sense of meaning as well as social connection. So the loss of work is broader than just the economic impact. Research from a number of different disciplines have examined the effect of economic shocks on mental health and suicide. There's been, for example, investigation of the global financial crisis, drawing on survey and administrative data. The evidence of national differences arising from these type of research suggests that policy responses can make a difference in terms of the mental health effects. And more generally, there's a body of quasi-experimental designs that have shown that externally driven increases to income, such as those associated with changes to minimum wages or changes to income support payments, can lead to noticeable improvements in population mental health. The Australian response to the COVID-19 crisis has included a range of economic policies, as well as enhanced provision of mental health services and support, such as online and telephone helplines and the delivery of mental health services via telehealth. We're also interested in whether we can discern mental health benefits associated with the rollout of economic policies. One final point, the COVID-19 crisis is obviously different in key respects to the GFC and other economic shocks. There are overlaying health concerns, and the types of social and behavioural responses that have been introduced in response to the pandemic can themselves undermine mental health, such as the lack of social connection and support that's a key facet of the policy responses. I suppose it's also worth noting firstly that I will generally use the term distress or psychological distress during this presentation, while referring to mental health as a broader term. I'll be referring to the type of symptoms that are associated with anxiety and depression, the so-called common mental disorders, but the discussion is not considering clinical disorders or looking at diagnostic criteria. So the Pulse of the Nation survey being run by the Melbourne Institute is one of many surveys and studies underway examining the impact of the COVID-19 crisis in Australia and around the world. The goals and purpose of research should always drive the decisions that are made about the research design and the methodology. So the context in which the survey is taking place can be described as unprecedented, as a dynamic environment, as one filled with uncertainty. We have a range of health, economic, psychological, and interpersonal concerns that researchers are interested in. And in this context, there's a need for information to help us understand and to respond appropriately. So the goals of the Pulse of the Nation survey are to measure and, where possible, a core set of policy relevant indicators to track economic and social well-being over time. The Pulse survey seeks to be relevant to Australian policy, which motivates a focus on a representative sample with adequate size. So we have around about 1,200 respondents at each of the waves of the survey. So our analysis today is based on up to 14,500 respondents. And if we just focus on working age respondents, it's around about 11,000. The sample itself is drawn from a dual frame sampling frame with telephone interviews and an online panel. The application of weights reflecting age, sex, and location further increased the representativeness of the findings. The survey is aiming to monitor change in population over time. So to do this, we use a repeated time series design to provide repeated snapshots of the Australian population using the same measures on each occasion. From a practical perspective, it's also important to minimise respondent burden. And it's critical also to minimise costs. So the survey is brief with a small set of key indicators. As is the case in most research, the research design involves compromises. So while the survey maintains a breadth of topics, it cannot provide the same level of depth of measurement. So let me describe how mental health or psychological distress is measured in the Pulse survey. The Kessler Scale of psychological distress is one of the most widely used instruments in the world. It assesses symptoms associated with anxiety and depression. The Kessler scales are used to screen for common mental disorders in primary care. The scale is used as a key element of many cohort studies, including many ABS surveys, such as the National Health Survey. It's also a key performance indicator in the National Mental Health and Suicide Prevention Plan. The Kessler scale comes in two commonly used forms, the 10-item K10 and also the K6, which surprisingly includes 6 items. Due to the constraints I discussed earlier, the Pulse survey only includes a single item to assess distress. This item is based on the K10. The item asks, during the past week, about how often did you feel depressed or anxious? And those who respond most or all of the time are classified as experiencing psychological distress. Because we wish to assess change in distress over a relatively short period of time, the question asks about distress during the past week, whereas the K10 and other Kessler scales normally reference a 4-week period. It's important to validate this item. So one wave of the Pulse survey has included the K6 as well, referencing a 7-day period. The K6 items ask about feeling nervous, hopeless, restless or fidgety, so depressed that nothing could cheer you up, that everything was an effort, and worthless, and use the same categories as the Pulse of the Nation item. So we can directly compare scores on the K6 to the Pulse item. So the Pulse item identified 18% of respondents as experiencing distress, and the K6 identified 17%. The K6 scores, items are summed to provide a total score. And what we can see on this plot is the mean scores, the average scores at each level of the Pulse item. So we can see that the average K6 scores for those people who answered all of the time to the Pulse item are much greater than the average score to those who said none of the time. And there's a linear effect over time. In addition, we can examine the cut point of the case of the K6 as a standard in a receiver operating characteristic plot to consider whether high scores on the Pulse of the Nation survey are true positive scores and low scores are not false positives. So we want the red line here to hug the horizontal top axis and the vertical left axis that demonstrates that the scale has the best discrimination. In this instance, our receiver operating characteristic area under the curve measure is 0.93, and that generally suggests that the item is an excellent fit and match with the gold standard. So this is just a selection of the analyses that we've conducted to evaluate the new item in the Pulse survey. All up, I think the Pulse survey measure of distress looks pretty good. It has sound psychometric properties. It captures most of the variability in classification on the case 6 scale. I'll reiterate, this isn't a clinical measure, and we're not suggesting that we're measuring clinical disorders, but we're looking to identify those in the sample in the Australian population who have experienced significant levels of distress. And we seem to be able to do that with this measure. Of course, the item itself has limitations, but I think we can be confident it can provide useful findings, particularly in the context of regular population monitoring of distress over time, where we have a set of constraints that limit the potential measures that we're able to include. The next set of analyses are looking to compare the pulse findings to a pre-COVID benchmark. This analysis serves two purposes. Firstly, we want to check whether the pulse measure shows the same pattern of results across key socio-demographic groupings. But perhaps more importantly, we want to see whether the levels of distress in the Australian population have risen and for whom. To do this, we draw on data from the nationally representative Household Income and Labour Dynamics in Australia, or HILDA survey, which included the K10 most recently in 2017. We focus here on two items from the K10 that assess feeling nervous or feeling depressed. But note that the reference period is 30 days, not 7, as in the Pulse survey, so there is some difference between these measures. And what we do is we compare this 2017 HILDA survey data with the first wave of the Pulse survey, which was conducted during the week commencing the 6th of April. So what we see is that just under 10% of Australian adults were identified with psychological distress in the 2017 HILDA survey, compared to around 20% of those at the first wave of the Pulse survey. The HILDA survey data also shows, as most research in the field does, that women have higher rates of distress than men. And the Pulse survey shows a similar pattern, although again noting that the rates in the Pulse survey are double that what was found in the HILDA survey. We can look at broad age differences. The HILDA survey again shows the expected pattern of results that we find in most other research, with patterns with levels of distress declining with increasing age. The Pulse survey again replicates this same well-established pattern of results, but it is noticeable that the rates for the youngest respondents show a much greater increase relative to the HILDA survey than the other two age groups. This is consistent with much of the discussion about how the burden of the COVID-19 crisis has fallen disproportionately on younger Australians. Finally, we can consider labour force status among working age respondents, that is, those aged between 18 and 64 years. The HILDA survey data shows that on average, people who are unemployed report much higher levels of distress than those who are employed, with those who are not participating in the workforce, whether because of disability, home duties or caring responsibilities, also having significantly elevated levels of distress. The same general pattern is observed in the Pulse survey, but importantly, the levels of distress, the increase relative to the HILDA survey, are much greater amongst those who are identified as being employed. So in general, the pattern of results across different population subgroups in the Pulse survey is consistent with expectations based on previous research, including the 2017 HILDA survey data. And this provides further evidence of the validity of the Pulse measures of distress. Although the measures are not identical, the findings are also indicative of a substantial increase in distress in the COVID context compared to when the HILDA survey was conducted in 2017. We also note the relative increase in distress is greatest for the young, who had the worst mental health at baseline and are also argued to be those most disproportionately affected by the COVID-19 crisis, and also the employed. This is the group who was doing best pre-COVID. So it's probably worth recapping where we're up to. So far, I've discussed the Pulse of the Nation survey and the new measure of distress that we've used. I've presented some of our analysis that validates the measure against the well-established K6 scale, and we've compared levels of distress in the pre and post-COVID context and looked at key socio-demographic groups. So the next set of analyses will capitalise on one of the key features of the Pulse survey, that is, mapping patterns of distress over time. And we'll examine distress over 12 weeks from the 6th of April through to the 22nd of June. In addition to considering trajectories of distress over time, we'll also draw in some other data that will enable us to consider potential factors or reasons that may be leading to the variability that we observe. So because of the focus on employment in the analyses, I'll be concentrating on working age respondents from now on. So again, that's 18 to 64. Here I present results on the full scale from 0 to 30%, which may hide some of the variability. But what this does is look at the levels of distress over the 12 weeks, from the 6th of April on the left through to the 22nd of June on the right. It's important to note that the difference between the highest and lowest point on this graph is actually greater than the difference between men and women presented earlier, and similar to the difference between the middle-aged and the older age groups. The figure does show some evidence of a curvilinear relationship, with distress declining from the beginning and then showing a bit of an uptick towards the end of the time series. But it's important to note that there's error associated with all of the measurement and the sampling, and so wave-to-wave variability may be masking broader trends. So what we'll do is we'll look at a smooth trend result that averages the level of distress across adjacent waves to try and iron out some of that variability. When we do this, the trend that I mentioned becomes more obvious, declining from the initial starting point and then showing some hint of an increase in the last few weeks. I'm only presenting the overall results here. There's insufficient time to present results separately by gender or age group, but it's important to acknowledge that employment status and distress are both potentially strongly associated with age and gender. The current analysis that I'm presenting here shows, however, a similar result for both men and women. So let's now just focus on the region of the graph where the variability is occurring and blow that up by changing the scale. So this is exactly the same graph as before, just a close-up. It's important to consider whether the variability over time that we observe here is real. Does it reflect variation in distress that's associated with other changes that are going on? Perhaps concern about the health impacts or the economic concerns of the COVID crisis. So providing and showing correspondence between the change over time in distress and other markers could increase our confidence in this measure and increase understanding of what is driving distress in the Australian population. So what we've done is we've drawn on data from Google searches conducted in Australia over the past 12 months. So these the frequency of searches are ranked on a scale from 0, which indicates no searches, to 100, which is the week in which the greatest frequency of searches for a particular term occurred. We're going to argue that the frequency of the use of these search terms may provide some insight into the concerns that Australians had at different points in time. And we can compare the trajectory of distress with the trajectory of these searches. So the first term that we look at is coronavirus. So we can see here that Google searches for the term coronavirus, which may reflect health-related concerns, peaked in the week or two prior to the start of the Pulse survey. and that there is a fairly close correspondence in the rate of decline week to week for both searches for the term coronavirus and levels of distress in the Australian community. The second term that we looked at was the term COVID. So again, Google searches in Australia for the term COVID peaked the week prior to the Pulse survey commencing. To the extent that there's a close correspondence, this could indicate that levels of distress in the Australian population also peaked at that earlier point in time, and that we're picking a low. We've started the survey at a point where that peak had already been achieved. Interestingly, searches for the term COVID showed a similar increase towards the end of the time series as what we found when we looked at the prevalence of distress. The final search term that we'll look at is Google searches for job seeker. This is done in the expectation of increased concerns about the need for income support having lost jobs. So Google searches for the term job seeker in Australia peaked in early April and also show a pattern of decline over the weeks. So we examine these Google search terms thinking that they may provide some insight into change in the concerns of the Australian community and find correspondence, albeit only using a very limited number of observation points, in this case 12. So finding a correspondence between the Google search terms and the pattern of distress measures included in the Pulse survey. The other thing that we can do is have a look at the relationship between distress and labour force status. So here we're looking at unemployed with the red dots and lines, employed, who are the blue dots, and people identified as not participating in the labour force with the green dots. And what we see, similar to the earlier results with the Hilda survey and the first wave of the Pulse survey, is that unemployed Australians had the highest level of distress. There was a decline in the distress amongst people who were unemployed from the peak in mid-May. Employed respondents, the blue dot, showed a more gradual decline from early in the time series and a bit of an uptick towards the end. In comparison, the not in the labour force group, which is a fairly heterogeneous group, combining people in parenting or caring roles, those with health, disability or other barriers to employment, or those who may be early retirees, show a fairly stable level of distress over time. So just to recap, we've now looked at patterns of distress over time for the key groups and explanations, and the final part of the presentation will look at mental distress, policy responses, and also the experience of financial distress. So this is the same graph as we looked at previously, but I've put some time markers in place. So what we're interested in here is the introduction of the coronavirus supplement. So this began to be rolled out from the 27th of April, and it effectively doubled the rate of job seeker allowance. Given that it was rolled out from the 27th, it would take 2 weeks, so the 27th and the 4th, for it to be received by all people receiving the job seeker allowance. So let's use that as an interim period, and we'll have a look at the 3 observation periods we have before as the pre-coronavirus supplement measure, the 3 waves after, which takes us from the 11th of May up to the 25th of May, and then we can also look at longer term results as well. It's important to also recognise that not all people who are unemployed receive the JobKeeper payment, and not all people receiving the job seeker payment will be unemployed. But what we're trying to do here is test if we can see an effect of the introduction of the supplement that will be largely restricted to this group. So when we stratify when we look at the analysis, we see that there's no difference in distress for the unemployed respondents during that pre-period versus the post-period. Whereas during that same comparison, we find that those people who were employed show lower distress in the post compared to the pre-period. What we do see, however, is a longer term difference for those people who are unemployed. So in that week from 8 to 12, levels of distress amongst those people who are unemployed is much lower than what it was during that pre-rollout period. So this provides some evidence, perhaps, that the introduction of a major policy change, the doubling of the amount of payment for those people receiving job seeker payments, perhaps did have some effect on the levels of distress experienced by those people who were unemployed. But what we observed was a delayed impact rather than an immediate impact. Why might this be? Perhaps the effect was swamped by the broader concerns earlier during the observation period, or perhaps the effect was moderated by the fact that many people had accessed their superannuation earlier than this and thereby not experienced the same level of distress that they otherwise may have. When we stratified the analysis by gender, we found that the significant longer term difference between in distress for those who were unemployed was significant for unemployed men, while unemployed women showed the same pattern of results, but it didn't reach a level of statistical significance. The other thing that we can do is look directly at the experience of hardship, deprivation, or financial strain, and consider how that is associated with the level of distress reported in the Pulse survey. So the Pulse survey includes an item that assesses financial conditions. And what we find if we look at that item is that the effect of financial stress, which is indicated by the dotted lines for both for unemployed, employed and not in the labour force respondents, is much greater than the effect within labour force status itself. So this suggests that the effect of financial strain is strongly related to mental distress, more so than labour force status. Rates of around 40% of distress for those who are reporting financial distress compared to around 10% for those without financial stress. So, in conclusion, these are just early findings and present a broad cut of the data. Further investigation will consider age, gender, and other differences in more detail. However, the Pulse of the Nation survey can provide insights into the patterns of distress of the Australian community over time during the COVID-19 crisis. The results suggest that levels of distress in the Australian community are much higher now than pre-COVID, particularly amongst the young and those who are employed. The approach that we use with repeated snapshots of the Australian population over time show how distress has been changing. There's some evidence that the increase in job seeker allowance following the introduction of the coronavirus supplement may be associated with a longer term decline in the level of distress amongst those who were unemployed. It's a turbulent context with much change over time, and the variation in levels of distress seem to coincide with variation in health concerns as measured by Google search terms. And the effect of changes in payments may be masked by anticipatory effects because the changes in policies were announced before they were implemented, or perhaps they're moderated by the fact that people in adverse circumstances have accessed their superannuation earlier. However, it's important to recognise that financial stress in the survey was strongly associated with mental distress. The findings suggest that in addition to providing mental health specific support and treatment for Australians, the social and economic determinants of mental health need to be front of mind when considering ways to protect the mental health of the Australian community during these difficult times. And finally, the single item measure of distress included in the Pulse survey has limitations, but we have shown that it's strongly related to one of the most widely used scales in research, policy and practice. And it was the brevity of this single item that enabled its repeated inclusion in the weekly representative survey over 3 months, which is what is the basis for these insights. Thank you very much.
So I'm going to ask a few questions and then I will turn to Vicki. First question is, do you know anything about the impacts of COVID-19 on children?
We don't through this survey. So this survey was restricted to adults aged 18 and over. And I think that's much of the focus of much of the research that's going on. It may well be that Vicki will be able to provide some insights into the experience of children as well. So without setting her up, without being able to answer that question, that's a possibility perhaps.
Yes, so we hope that Vicki will have a response to that question. If not, we can explore it further.
Exactly.
Next question is, how would you compare the stress of actually being employed versus the stress of worrying about becoming unemployed?
And I think that's very much what we see when we look at that change between the Hilda survey results and the first wave of the COVID survey. I think we saw that the effects of stress, the levels of distress were much elevated amongst the employed group relative to what we found earlier, and that could be associated with the stress and concerns about losing work, the uncertainty, the greater levels of insecurity. I've done a lot of work looking at broader psychosocial factors associated with mental health that shows that whilst we've collapsed all employment together in the category that we're looking at, that there's as much variability within employment circumstances and the effect that has on mental health than there is between employed and unemployed cases. So without a doubt, many people currently in work will be experiencing elevated levels of a sense of insecurity, and that will be associated with levels of distress as well.
Okay, great. Vicki, I think let's turn over to you for your comments, because I think there's going to be I'm seeing some of the questions coming in will benefit from answers for both you and Peter.
Thanks very much, Abigail. Thanks for a great presentation, Peter. I'll just start by acknowledging I'm on the lands of the Boonwurrung and Wurundjeri people of the Kulin Nation. And I really want to acknowledge elders past, present, and particularly from the Headspace lens, the emerging elders are really critical. And I guess it's particularly important in the context of disproportionate impacts of socio and economic factors and mental health outcomes in terms of Aboriginal and Torres Strait Islander people in our country. A great presentation, Peter. Really stoked that the Pulse measure works so well. That's very helpful for us, conscious of over surveying young people. So the Headspace age range is 12 to 25. I'll just say that because I'm going to mention a few surveys that we've done, particularly in answer to some of the questions. We did a National Youth Mental Health survey in late 2018, which found a trebling of the measures on the K10 compared to Hilda. So for, I guess, what consistent with what Peter reported, there is a disproportionate increase in distress in our Australian young people. Yeah, just in general, pre-COVID. We did a more subjective survey in approximately April this year, and really interesting findings consistent with what Peter's reported, but yeah, perhaps a bit more pointed in their outcomes. So 40% of young people that responded, I think it was a survey, I think we had about 4,000 young people respond. Yeah, 40% of those young people felt that COVID-19 had impacted their confidence to achieve future goals. And I think that's really interesting about future orientation, the tasks of adolescence, young adulthood. We know that young people are disproportionately impacted by the unemployment rates, but also thinking about what they're trying to do in terms of study, etc. That's a pretty concerning result in terms of future mental health concerns. The other thing that is more than half of the young people said that they felt COVID negatively impacted their social context. And again, that's a really important part of the Headspace age range. Just under half reported that their routine and mood had been negatively impacted by COVID. And so I guess what we're seeing is some of the things that are critical in the age range and support people's mental health, you know, having future orientation, meaningful activity, good social connectedness, routine, etc., are negatively impacted. There were some interesting findings. We saw slightly different interpretations of the impact of lowered mental health by the young people themselves compared to family and friends. They weren't markedly different. I think just a different interpretation, which is probably appropriate. We again saw gender disproportion, so young women much more likely to feel that their mental health had suffered. Young people who were identified as LGBTQIA+ were also reported that they're more likely to report that their mental health had suffered during COVID. So yeah, I mean, really results that resonate with Peter's results. I think it's really great, useful to see the impact of the policy initiatives being useful. It would be good to unpack that further for young people, because the casualisation of the workforce, I think, for that age range is really different. The other thing I guess I was reflecting on while you were talking was the concern that many children and young people would have perhaps about their parents' income, and also the sort of stress and concern associated with working at home, supporting children to homeschool, those sorts of things, and probably beyond the scope of what you were looking at, but just the kinds of things that we have noticed a bit coming through. Yeah, I might leave it there and see if there's any other questions or comments.
Great, thank you, Vicki. And welcome back, Peter. So thank you very much for your comments. I think what I'm noticing in a little bit of questions is questions around how do we think about distress and family status. And I know, Peter, you haven't used the data to that extent to study that yet, but I will mention that in recent weeks in the survey, we are asking questions around family composition. So that is an area of future research, which will keep you going. You know, I think what's prominent, especially those of us who are in Victoria or mine, is that given there's been a difference in responses to and experiences of the pandemic at the state level, is there any information on patterns of distress by state or territory? And then I will add on to that, because I think both of you may have questions. With the most recent Victorian lockdown, I certainly know I am less happy today than I was a few days ago. You know, if you're going to predict in the future, what do you think we're going to start observing in the coming weeks?
I think that's one of the next steps for the analysis as well. I think we've just, today I've just presented a very broad brushstrokes in terms of what the association finds at a national level, and not even differentiating some of those key socio-demographic groups or differentiating by gender. So I think that the next steps are to try and map those levels of distress as well to perhaps more localised patterns. So we can look at number of cases in different local areas and see how that is associated with concerns. The decline that we observe in distress and the decline that we see in the search terms, the Google search terms, corresponds to the period of time when people were probably feeling more confident that things would be coming under control, that the number of cases, the regular reporting, the numbers were getting smaller and smaller. So we can nuance the analysis by looking to see whether we can observe different patterns by looking at different states and whether the patterns differ. There's a longer lag before we see those declines over time, and linking the experience of distress directly to the environment and the environment that's causing the concerns and the worry.
Vicky, do you have any response to that?
Yeah, I mean, I think it's interesting, these sort of field of thought that we've been thinking about since March is really the literature that tells us about mental health impacts from natural disasters. And I think that area of thinking is starting to broaden to complex stuff happening in the world, like pandemics. It may or may not be a reasonable model. I'd be interested in your thoughts about that, Peter, or your findings longer term. But what we see is these heightened distresses beginning, and then much pretty profound long-term impacts on mental health as well. So I think that's really interesting, and often those experiences have the same impact on financial stress and unemployment in those areas as well. So if we think about, some experts I've been working with in that space, we have different parts of our country in different stages of recovery in terms of being directly impacted. So Victoria would be seen as back in the sort of in it phase. And again, we've got places still really just reaching recovery stages from bushfires, floods, etc. So we're not talking about the pandemic in isolation as well, in terms of things like Peter's looking at. So, I mean, I think what you're doing is great to have a look at this stuff in the much longer term, finding a measure that is a good snapshot. I think it also speaks to policy changes like real-time suicide data monitoring should be included for us to get better pictures. The other thing I was thinking is it would be the natural disaster literature talks about sort of positive gains in terms of resilience, and I'd be interested in if there's anything you've looked at in that, and if whether we will or won't start to see that kind of impact from COVID.
Excellent. I think we're going to have time for one quick question, so I'm going to ask for brief responses. And the question is really, if you were talking to the government, knowing 3 months ago, knowing what you know today, would you have recommended different policy actions to help minimize the effects of COVID-19 on distress?
Oh, it's tough going back in time, isn't it? I think that there's the issue of uncertainty and the issue of economic security as well. I think the increase in the payment level may well have addressed that, but it hasn't been received by everybody. I think the JobKeeper program may well have been effective, but it hasn't addressed everybody. So I think it would be more the coverage issues, I think. So being sure that if we recognise the importance of these factors, that we're addressing the coverage of these responses would be the suggestion earlier on in time.
Yeah, I completely agree, Peter. I think the concern around the time-bound nature of the payments is probably really worrying. I would advocate strongly for real-time suicide data monitoring because of what we need to find out there, and continuation of telehealth items as an access point, and policy announcements that would see the recognition of the likely long-term impact on people's mental health as well.
Yeah.
Great. Thank you, Peter and Vicki. Unfortunately, we are out of time. To those of you who are online and ask questions, we will be posting answers to the questions on our website, as well as providing the video recording of this colloquium. So I hope you have enjoyed this colloquium, and we'll look forward to seeing you at our next one, which is going to be on July 21st with Associate Professor John-Se Young, who will be presenting on the topic of should hospital funding be linked to the socioeconomic status of patients. I encourage you to register for one or more of the upcoming colloquia. The link to registering can be found in the chat function at the end of this event. Thank you again, Vicki. Thank you again, Peter. Thank you, everybody.